Coming up on Need to Know, it's a problem that's not going away. In fact, it's only getting worse. The heroin and opioid crisis in our region is taking lives, destroying families and neighborhoods, and shattering dreams. Tonight, we hear from addicts trying to reclaim their lives, a family with a message for others struggling to help their loved ones, experts working to peel away the layers of addiction, and the women of a special coffee shop whose once broken dreams are being rebuilt. Stay with me. This special edition of Need to Know starts right now. That is the number of deaths in 2016 related to heroin, opioids, fentanyl, and related substances within the 10 counties served by the Monroe County Medical Examiner's Office. That's a number that grew 142% in 1 year, from 2015 to 2016. It's also a number that the Polito family, like countless others, feared would include their own child, Mary Jo. 2016 was when they learned their daughter was addicted to heroin, and when life as they knew it changed. The Polito family's story is one that may resonate with many watching this broadcast. It's a story Mary Jo herself wanted to share, solely in the hopes of helping to save at least one life. Mary Jo, when did your journey with addiction begin?
My journey began in approximately 2008. In 2003, I was in a car accident where I had a severe back injury. In 2008, I had surgery on my back. I was prescribed pain medication, which I had been prescribed since 2004. The addiction didn't begin until after my surgery. I started abusing the medication, taking too much, running out, which progressed into turning to heroin. I was cut off on my pain medication from my doctors, and I turned to buying them from the street, which in turn led me to, I believe it was September of 2013, I purchased heroin for the first time. Honestly, I didn't realize I had an addiction when it was pain pills. I had convinced myself that I was treating my pain and that I needed these pills, just kind of ignoring the fact that I was abusing them. When I started using heroin, I hid it from everybody. I hid it from friends, I hid it from my children, my family. It wasn't until I started that first outpatient that I admitted to my family that I was using heroin.
At that stage of the game is when we went and pulled them out and brought them to our house. And it wasn't a matter of whether she liked it or didn't like it. We didn't even question that, you know. And she didn't fight it either. I mean, she was addicted, and that's all there was to it. And the addiction is all they can deal with, you know. So that's probably when I realized that she was really in trouble.
The end of June, I went on about a 5-day binge with my ex, and we were using for 5 days straight. And when I woke up that morning, I had been up from the night before, parked outside of an M&T bank with my car running, and I was waiting for the 24 hours to come up so that I could take more money out because I had taken out the limit that day. And I was just disgusted with myself. I mean, I was at a point where I hated living. It wasn't looking forward to getting high, it was because I had to get high. I had to not be sick. There was nothing enjoyable about it anymore. And I was away from my family, my kids, for 5 days, no contact with them. And I had just come to a point where I also was knowing that it was going to be where I was probably going to lose my family and lose the place where I was living. And I said, that's enough. I couldn't do it to myself, and I couldn't do it to my family anymore.
How would you describe this road to recovery and how it's different than in the past?
I don't remember a time that I've actually enjoyed life like I do right now. And I'm going back probably 25, 30 years. You know, I think it's important to know about addiction is that a lot of people are numbing their pain with using. They don't want to feel sadness or physical pain or emotional pain. And that's probably what started with me is I noticed that I didn't have to feel anymore. The methadone program has worked great for me. I'm held accountable, which is something I really like. I have to go every day to get my dose. I don't have the accessibility to it like I did with Suboxone. So that works really well for me. Since I've engaged in recovery and really wanted to get something out of it, I really have wanted to focus on getting and staying clean. And just in learning more about addiction. It's important for me to communicate with all 3 of my children because I want them to be aware of how serious this disease is and that people are dying. I want them to know that they're predisposed because I have the chemical makeup of an addict, and in their cases, their fathers do as well. So I told my daughter, my youngest daughter, the best advice that I can give her is don't think it can't happen to you.
When she finally came in this last time was when she decided that she really wanted to help. And like we says, we're there for you 100%, you know, and that's basically it. We'll support her all the way, you know, now. And I mean, that's the scary part because it's like I says, you know, they talk about relapsing. You hear so much about the relapsing. When that situation, if it ever comes, which I hope it doesn't, you know, we'll deal with that when we get to it. But right now, everything's good, so.
Gotta stay in the moment.
Yeah.
The very first thing that I learned and came to realize is that if you help them or enable when they are an active user, you're hurting them. You need to, like, because I remember that feeling if she wanted $10 for something to eat, okay, if I give her this, maybe this time, she'll come back around. You know, and it's just that's the feeling you have. It's like, let me do this for her because maybe this time it's gonna work, regardless of what it was. The second thing that I really came to a realization for is to remember that addiction is a disease. I think that's real important to understand and to believe because it helps you look at your loved one better in the way that they're not doing this to hurt you. They wish they weren't doing it. And then to understand and try to support them when they're ready.
Your life will change. It's going to change. And there's nothing you can do about it. I mean, it's not nobody's fault, but you're going to have to change your life and adjust things to the situation that you're in now because it's never going to be the same as it was before. You always have them questions, and you have to change to survive also, you know, as you're going through this. And we've done that to a degree. Mm-hmm. And I mean, I just wanted people to know that you're never going to be the same as you were before.
We went out for ice cream together to celebrate 60 days clean. Just, it's nice to be recognized for those small achievements. And I shouldn't even say small because they are big achievements. in the world of addiction. So, but I do like to take it day by day. Sometimes you have to, just to say I made it through another day without using. It's a constant battle. And as good as I feel right now, I don't let myself forget that. I won't forget where I came from. I won't forget that I had a 1.5 years clean and I relapsed.
Mary Jo, for people who see and hear your story, who themselves are struggling with addiction, what do you want them to learn from your journey?
There's a couple things. One thing I want to say to those that are still suffering, don't be ashamed of this disease. That was something I had to overcome, to think I was going to be an embarrassment to my family or to my kids. So don't be ashamed. There are, although there is a lack of resources, there are resources that are available. So take advantage of those. And I just want to tell them not to give up. There is hope, and we do recover. As cliche as that sounds, it's true. You just have to want it.
Relapse is Mary Jo's greatest fear, but right now she's focused on moving past her fears. She has her sights set on getting her certification as a peer advocate to help others struggling with addiction and recovery. The heroin and opioid epidemic, declared a national public health emergency, is a problem surrounded by questions. Joining me at the desk to help make sense of some of the most pressing questions and concerns in relation to addiction, treatment, and support is Jennifer Farringer, Director of DePaul's National Council on Alcoholism and Drug Dependence Rochester area, and Dr. Aaron Fields, an addiction medicine physician and instructor of clinical emergency medicine at the University of Rochester Medical Center. And welcome to you both. I appreciate you being here.
Thank you. Good morning.
So I'm going to ask you this first, Aaron. How does drug addiction work? So whether we're talking about opioids or heroin, how does the body become so addicted that it gets to the point where some addicts in recovery said to me, I will do anything to get it?
I mean, the best analogy I can come up with is if you felt cold, you would do anything it took to get some heat and some warmth. It's that same primitive drive that gets commandeered by the addiction. It's the same brain receptors that respond to opioids that respond to a lot of the internal molecules that our brain makes. They're called endogenous opioids. And those pathways get commandeered by the addiction when it's being flooded with heroin or with prescription opioids. And so that same primitive drive to do what it takes to survive gets directed towards finding and using drugs. And so it's not this conscious choice that people are making to go out and find drugs. It is an inherent drive that they often will describe watching themselves do all the destructive behaviors that got them into the addiction in the first place, but feeling helpless to stop themselves.
Well, Mary Jo and the Polito family, from them to others that I've talked to about this epidemic, there's something that I have consistently heard in my conversations, and that is that immediate access to treatment options in our region is lacking tremendously. And Mary Jo said to me, when you're a heroin addict, you have a window of time when you want help. And when you finally find a place that can take you in, and you hear you have to wait a week, 2 weeks, several weeks, that window instantly closes. And so I want to know, is this changing, Jennifer, in our region? Okay, talk about that.
It is, and thank God it is. So are we where we need to be? No, but we've made huge steps. So one of the biggest pieces is the opening of open access. Open access is staffed by multiple treatment providers. It's located at 1350 University Avenue. The intention is that a family member could bring someone in, someone could self-refer, police could bring someone in, someone could come from the ED. Anyway, immediate access to get assessed for what is the appropriate level of care, find the appropriate level of care, identify the first available slot, and then assist with transportation or insurance barriers. So it's not perfect, but it's so far beyond where we were at. And there's open access like things happening as well. So that was the first thing that started in August. It's now in full swing, 7 days a week, 4 p.m. to 10 p.m., purposely, because that's typically when the normal assessment hours close down. But there's 3 treatment providers. There likely will be more by January, that have started walk-in evaluations. So they'll set aside time slots, days of the week. Those are all represented in our treatment provider template, where someone can do the same thing, basically. Walk into that treatment provider, get immediately assessed for appropriate level of care, and get into treatment.
So when Jennifer mentions appropriate level of care, this is something that I try to understand. Is there, or I'll ask you to do this, if you can, Erin, paint what effective treatment looks like, and does appropriate level of care look the same for everybody?
No, everybody needs a different plan for treatment. There are some people who their addiction's more mild. They're using pills, they're not using every day. They've got more of a behavioral dependence or psychological dependence or addiction than they do the physical. And they don't necessarily experience withdrawal. Those people are perfect for an outpatient program where they can still live at home, still be embedded in their community, still have the direct support of their family members. They just need this extra assistance to get some counseling to help understand the behavioral patterns that feed into their addiction. And then there are people who are using much more regularly, who if they try to stop on their own, they're going to develop withdrawal symptoms, which, as I mentioned, that primitive drive is part of those withdrawal symptoms, and you can't fight them as easily. And that's where, as Mary Jo mentioned, the medication-assisted treatment comes in with methadone or Suboxone, and for some people, naltrexone, a complete blocker, to take away some of that craving and to allow you to focus on engaging in treatment.
How do you know if you have found the right plan? How does a family know if they found the right plan? I mean, is it a matter of, I don't want me to say trial and error, but is it trying different things to see? I mean, does it come down to that?
No, the assessment process, so what there is now through OASIS is a locator, and that's an online tool to determine what is the appropriate level of care. So it's not a matter of the family trying to figure out, where do I send my child? The first step is getting an evaluation, getting an assessment, finding out, as Erin just described, what is the appropriate level of care? Does this person need medically assisted treatment? Are they further down into the addiction that there's maybe other medical issues going on that perhaps they need inpatient? So there's so many, and everything in between, outpatient, inpatient, medically assisted treatment, multiple levels of care.
Well, the Polito family, they expressed some great concern in regards to pain medication and it being prescribed to Mary Jo for X number of years for back pain due to a car accident, later on a surgery. And Dennis Polito said, it just doesn't make sense to me, because how do you get it so freely and then get to a point that a doctor will no longer give it to her? Jennifer, I've read something that you've written about this. You said between 2010 and 2015 that the amount of prescription pain medication prescribed by doctors in Monroe County dropped significantly. So by how much is this downward trend, will this continue?
So a couple things happened. It was 2016, 2015. New York State passed laws where, for most cases, the allowable prescribing of the pain medications was reduced from 30 days to 7 days. That was a huge step, and that was a New York State law. It wasn't completely implemented, but by the end of that year, it was, and I think we're hearing more and more stories of where it truly is implemented. There are exceptions, but for the most part, so this is never about eliminating pain medication. It's about determining what's the appropriate medication, and if you prescribe pain medication, prescribe it for the least amount of time and the least amount of dose, as conservatively as possible, and to consider thinking of alternative therapies or non-addicting things, like, will ibuprofen do the trick? I've heard more and more dental surgeons, for example, saying we don't even go down the road of opioid pain medications. We use ibuprofen or Tylenol or something like that. Or for somebody that has chronic pain, have they tried seeing a chiropractor, an acupuncturist? Have they tried therapeutic massage? There's a variety of ways, I think, that we can do a better job working with pain rather than risk someone going down the road that this family described.
You're nodding. Erin, do you want to jump in on that?
Yeah, more and more insurance companies are now starting to cover alternative therapies such as massage, acupuncture, physical therapy, which has been a conscientious push by healthcare providers, and some of the programs in our area, talking to the insurers and telling them, look, this is a problem. This is where this is coming from. You know, my initial training was in the emergency department, and early on in my training, the reflexive response when somebody had acute pain, you couldn't figure out what the cause of their pain was or how to fix it, was to give them a short prescription and tell them to follow up with their primary care doc. We know, and our guts were telling us at the time, this is the wrong thing to do. This is not helping people. And it comes down to getting comfortable having that uncomfortable discussion with somebody and telling them, look, I don't know why you're in pain. I'm not going to be able to fix it. Here's some things you can try that aren't dangerous.
I want to go to one thing, because I've heard about this, Safe Sober Site. And Jennifer, you have called this a game changer, a Safe Sober Site. Can you talk a little bit about what a Safe Sober Site is? I hear in North Clinton Avenue, we're seeing,
okay.
yes.
So when I was talking about the open access, and I was talking about the walk-in evals, there's a third way, and the third way is peer engagement. So would I call it a Safe Sober Site? Probably not. I would call it a way to do similar things that we're trying to do in open access, but through peer engagement.
Okay.
So there's staff, there's 2 of them right now. One is Tuesday afternoon, North Clinton, and that's staffed by peers of Recovery Fitness. And I know you had them in the show last week. Awesome group of people. There's another one on Thursdays in Gates to Recovery. Both use peers. The intention is peer talking to peer. I've been there. I know what you're going through. Let me help you get some help, and here's the resources. So perhaps not the clinical, it's not the clinical assessment, but it can get them to some of the clinical places, and that is, the goal is to get the person still to treatment as quickly as possible.
So we've got about 30 seconds left. I want to give you the closing word. What would you say to families that are saying, we need the resources, are more coming?
Yes, and please, 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 I mean, that's what I hear from families. If we had only known, I've tried to put under ncadd-ra.org, under our website, under resources, all the resources that I can think of that would help families. So if you go to that page, go to the resource page, you'll find the Monroe County Treatment Provider Template, you'll find a referral to all the recovery wraparound services, as well as the opioid brochure.
We have to close for now, but thank you to my guests, to Dr. Erin Fields and Jennifer Farringer. I appreciate both of you sharing your perspective on this. And to access information on programs and services, you did hear Jennifer say this. This is for those struggling with addiction and their families. Be sure to go to ncadd-ra.org. That website is on your screen, and it's how you can learn more about resources through DePaul's National Council on Alcoholism and Drug Dependence, Rochester area. If you're an addict in recovery, finding a job is not an easy feat. An arrest record, time served behind bars, and the permanent suspension of a driver's license can make gaining employment a challenge. But at the Coffee Connection, all of the above could make you the perfect fit. Places such as Park Lee, the University of Rochester, and all 3 Kitty Van Bortle car dealerships are stocked with the fair trade, organic, sustainably farmed coffee from the Coffee Connection. Here's a story of a local spot where hundreds of women in recovery have gone to gain job skills and much more.
Our joke is we're a life sentence if you let us be. The Coffee Connection is a nonprofit, and we work with women in recovery from addiction. It used to be merely an employment training program, but now it's some employment training and job creation program. So we have a number of women now that have been hired, and a number of them would like to be lifers.
I've never worked with coffee before. Did I ever think I was going to be working with women in recovery and coffee? No. Never, ever, ever. Learned how to do barista and became the front-end manager, and then manager, and then director of human resources.
Department of Human Services through Rochester Works refers women to us to do their work experience program, and then a number are referred from other halfway houses or recovery organizations. A lot come in on the recommendation of their friends. Women learn how to brew coffee, but they also learn how to grind coffee, how to flavor coffee, how to be a barista, how to make lattes and espresso shots. They learn how to use a POS system.
I've learned, from Joy, different communication skills, and how to deal with people. in a positive manner, and how to talk to people and rephrase things and reframe a situation that's negative, but get the good out of the situation too. You know, there's always good in a situation that you can reframe. And it's very important. I mean, I brought it to my house, you know, it's affected my family life.
I have personally met several of these women and spent time with them, and I have seen the difference in their lives. And every woman that we can help to get out of drug addicted or some kind of a criminal behavior and get them working, to me is just such an incredible gift to not only them but to our community.
The human aspect is that women's lives are being transformed and turned around.
Now I'm not afraid to speak in front of people.
On the financial end, it costs between $55,000 and $60,000 to keep someone in jail or prison or treatment for a year. And most of our women have an arrest record, and if they don't have one, it's just because they're lucky. So I would prefer to help someone survive and have a job and healthy children than pay for them to be incarcerated.
A lot of society looks at us like we're never going to be anything. You know, we're always going to be in jail or, you know, on the streets, whatever. But if people would just come here and see, oh my God, these women are in recovery and they're running the shops. We get people out of the system and give them jobs, as long as they do what they're supposed to do and they prove themselves.
We have not had any woman die while being in our program. I think we're really onto something, because I've always believed that people need a reason to live and a purpose and a meaning, and that's one of the things that we give here.
You can visit the Coffee Connection's 2 locations in Rochester and the South Wedge on South Avenue, and at its Main Street location at the Greenhouse Cafe. To learn how to become a community partner with the Coffee Connection to support more women in recovery seeking employment, go to ourcoffeeconnection.org. WXXI's coverage of the heroin and opioid crisis will continue throughout this year and next on WXXI radio and television. For addiction and overdose resources, be sure to visit WXXI's Second Opinion website. And that wraps up this special edition of Need to Know. I'm your host, Helene Bianduti-Hofer. Thank you for joining me tonight, throughout the weekend, and online at WXXInews.org. I'll see you next week.